Welcome to Nursing School Explained and this video on a Luer Lock. So as an example here, I have an IV cathlon that would usually be inside a patient's vein, and then it's screwed on to the cathlon right here. And this right here is an IV extension tubing. So the Luer Lock really is the screw that goes into that IV cathlon. But the Luer Lock is also on the other side here, which has that screw top just like the IV cathlon has on this pink part. And so it's nice with the Luer Lock, everything matches. So now if I take a syringe, I can hook it up here and it screws on, and or I can take an IV tubing and also hook that up here. So Luer Lock is just very compatible no matter what you use. And the nice part also is that the Luer Lock did have what's called a male and a female part. So the one with the rubber stopper that actually has that we're going to deliver the medication into is called the female part, and then the part that we're going to attach is the male part. And either way it screws on, and it's very adaptable between all of the Luer Locks, IV tubing, syringes, and so forth.